Beth Kiley. Now, in a recent study, women who did something called cervical mucus monitoring were more than twice as likely to conceive as those who didn't. Now, in my ebook, Personal Path to Pregnancy, I do discuss the various methods that you can use to monitor your ovulation to predict your fertile time. And I want to repeat that knowing precisely when you ovulate is the most critical factor when you're trying to get pregnant. Basically, timing is everything, and you cannot rely on ovulation calendars online or just assume that you ovulate on day 14, which is a mistake that many women make. So back to cervical mucus monitoring. This is one way that you can try to predict your ovulation. It's better if you use more than one method to predict ovulation, but for the purpose of this video, I will discuss cervical mucus monitoring. So basically, the amount of cervical mucus changes in both the quality and the quantity just before and during your ovulation. What you need to do is monitor the changes throughout your monthly cycle so that you can become familiar with what's known as fertile quality cervical mucus. So there are 4 stages. Right after your period, there are usually a few days without any mucus. These are called dry days. Then, as an egg starts to ripen, the more mucus is produced, and that is cloudy, and it feels sticky and tacky. Then, right before ovulation, it looks clear and it feels slippery. It feels a lot like a raw egg white, and it can be stretched. If you put it between 2 fingers like this, it's very stretchy. These are called the slippery days, and this is the peak of your fertility. This is when you need to be having intercourse to try to get pregnant. Now, after a few slippery days, then you will have less mucus. It will also be cloudy and tacky again, and then you may have a few more dry days before your period starts if you're not pregnant. Now, these changes signify that you have already ovulated. Now, the study showed that women who consistently kept track of their cervical mucus changes and had intercourse on the slippery days were more than twice as likely to get pregnant. Now, it should be noted, some women do have trouble with this method, and they get worried that they aren't ovulating if they're not able to see the slippery cervical mucus. Now, sometimes this is a good predictor that you're not ovulating, but other times things are perfectly normal and you're just having some trouble tracking the cervical mucus changes. So if you're uncertain, you can rely on another method to track ovulation, or you can see your doctor who can run some hormone tests to make sure that you are, in fact, ovulating. The important thing is not to panic, because that causes stress, and stress is definitely not good for your fertility. So I hope you enjoyed that tip for today, and if you are looking for more tips and strategies that can dramatically improve your odds of getting pregnant faster, then be sure to get a copy of my ebook, Personal Path to Pregnancy. There is a link at the end of this video, or a link always is in my emails that I send out. So I will catch you again in the next video. Thanks for watching. Bye.